fellow students. I am Dr. Vijayalakshmi, retired Dean of Community Science. Today I am here to inform you that a new course on diet management, health and disease is going to start, and this is a very important course for all the age groups, and diet plays a very important role in both health and disease, and the dietary habits that are formed in the early age remain in the adulthood also. And so today there is a lot of risk factors that are involved in increasing hypertension, diabetes mellitus, etc., which are very important because of the lifestyle changes. So all these can be modifying a little in the dietary habits. So if the healthy habits are formed in the diet during the early childhood, the same will remain throughout the adulthood, and one can lead a quality life. So there is a link between the nutrition and the health, which is very important because of the food that is taken by an individual. Dietary management is the science and art of feeding the individual or taking the nutritional care of an individual. So here the dietary management includes the changes in the diet and modification in the diet to improve the quality of life. So here the role of nutritionists and dietitians is very important, because they are here to counsel on the diet which is related to the age, the office routine work, and also the sex and other factors that are involved in an individual other than the diet. So the role of the dietitian is also to see that the changes in the preparation of food and the modification in the selection of food and how to select the food and utilize the food in the preparation is very important, and this helps in the modification of disease. So if a healthy diet is taken, the individual stays healthy, whereas on the other side, if a poor diet is taken, there is an increased chance of morbidity and diseased conditions. So here the nutritionists, because of the increased population and increase in the aged population, they have a great role in counseling the patients with regard to the diet and modification of diet in the individual. So different disorders require different type of modifications in the diet, which are only taught in this course, which the individual can learn and adopt for their own conditions, and also help the family and the society to improve in the dietary management. The dietitian's role has started way back in 1900s, and here the dietitians form a bridge between the patient and the medical team. So they advise the part of the food that they have to be taken along with the medicines that are prescribed by the doctors, so that the improvement in the quality of the life or the health improves very fast. So here the dietitians play a very important role. Objectives of the course are to identify the nutrition and dietary problems in segments of population, to devise socially, economically and technologically viable methods to control nutrition and dietary problems in the country, to devise newer management and administration techniques to monitor nutrition and dietetics, to encourage research and nutrition and develop future scientists for the country, to advise governments and health bodies on issues related with nutrition. So the dietitians also help in the policy making in the country with regard to the malnutrition problems. Now there are various specialized areas in the dietetics. So there we have different dietitians like the clinical dietitians, community dietitians, management dietitians, consultant dietitians, etc. There are a lot of job opportunities for the people who do this course. They can enter into the government jobs and help in the government offices, government hospitals, schools, then prisons and community projects, etc. Then they can also go into the sports and gyms, and they can start their own consultancy. They can go into the private jobs and also to the greater cafeterias, hostels, etc. So with all the advantages in this course, I recommend that all the students should participate in the course. Whether they are interested in the job or not, it is very important for improvement of the health of the individual as well as the society. So this course becomes a very important course, and it is a 3 credit course, and the course starts from February and ends in April 2020. So I thank you all. I welcome all of you to enroll into this course, and thank you.